So what I'm going to do with Lori is just one basic test here is we're just going to go with the empty can, just like so. Hopefully I don't break a bone like I just did. You know, how's your elbow?
It's fine.
Okay, good. All right, so I'm going to push down. I want you to resist as hard as you can and go. Okay, so what is that 1 to 10?
It starts up at like a 7.
Okay. And if you had to give it like an overall score, what is it?
It's 5.
Okay, so she's giving it a 5. Now, if I come around here and I'm just taking a look at her back here, and if I go to the mid-spine, okay, and I walk finger widths over 1, 2, 3, 4, it's a type 5. But I got about 5 finger widths there. You can feel that I'm hitting that bone and hitting that bone right between them, right? Okay, so it's about 5 finger widths, and we know that anything beyond 4 might cause problems. Now, it doesn't always, okay? Because sometimes you're going to find people that will be like 5 or 6 and be like, they don't have any shoulder problems. Okay, that's unique human variation. I'm giving you a general guideline, but that's why I have to emphasize truth to experience, because you're going to find the odd exception to the rule on just about everything. All right, but what I want to do is at least lead you in the general direction of what seems to work most for most people. So now what we're going to do is this. I'm going to press on her rhomboids to give her some stability there and see if that helps. Resist and go.
Yeah.
Okay, so you were 5, and what were you with the pressure there?
9.
Okay, good, and I could feel it too. That's definitely giving her more stability. So in her case, what we're going to do is we're going to go with this thoracic part protocol here. Now this is thoracic part for people whose shoulder blades are wide apart. Okay, but you're going to get one later on for people who are generally narrow. All right, but and if you look on the back, you're going to see the assessment more than 4 fingers distance, and then shoulder back is better. Generally, those are the things that would lead me here. Now, are you hypermobile at all? Okay, so what we would do is start off with a chest stretch for you, okay? So with a chest stretch, I would have you, if I could get you over here, all right? Now, inside arm would be on the wall behind you, okay? Then you step your inside leg forward. You kind of push your arm into the wall, relax, and try to open up and rotate away from the wall. So, inside arm is on the wall, slightly higher than shoulder height. Okay, inside leg steps forward. Now what I'd have you do is rotate away. Now you push your arm into the wall for 5 seconds, relax, try to go a little further. We're going to PNF it. If I get an older person, I might have them do the doorway stretch, okay? Or I might have them do this and just not PNF it, just do a normal stretch, because the PNF cue can confuse people. I use it somewhat as a progression for a lot of people. And then if they are hypermobile, I'd have them just percussing the pecs on the front, okay? Very simple. All right, but we want to reduce any of that excess tension here in the front. And then we're going to be going after retracting the shoulder blades isometrically in order to get the shoulder blades a little closer together, okay? So, I'm going to get you to do the other side while you're at it there, Lori. And what I'm going to do is I'm just going to read some of the things to be aware of for this. You know, we want to evolve and not become extinct. This is thoracic part. So some of the things to keep evolving is doing lots of wide grip pulling exercises. So face pulls, wide grip rows, wide grip pull downs, bent over rows. Basically anything where we're retracting the shoulder blades together. Okay, lots of variations on reverse flies, wall slides. Rowing and swimming are more favorable choices for cardio for her, because rowing and swimming you're going to be using more of the back, okay? Whereas I may not like her doing a lot of cycling because it's stretching out the shoulder blades. They're stretching apart from each other, all right? And you know, I make sure that I would do this, if we're going to do some chest work, we do this as like a warm-up cool down, just to normalize tension after. Because if you're going to get a client who's, you know, has some strength goals and is doing bench press, you don't want to say don't do chest ever again. You want to say, after you work your chest, let's just normalize the tension in your body. Okay, that should be good there. Let me get you to lay face down here for me, please.
Face down.
Yep. So now we're going to go into T retractions. Okay, arms directly out to the sides in a T. Now there's a couple different ways you can do this. You can do this thumbs down, which is going to get a little bit more of the rear deltoids. You can do this thumbs up, which is going to target more of the traps. They're both good. It doesn't really matter what you go with. In this case, I might just go thumbs up. Okay, but you can mix that up certainly. Now what I want you to do is And you're gonna find a lot of clients are gonna bring their arms back like this so they can start using the lat. And you're gonna have to keep bringing them forward for this exercise here. Now I want you to lift from between the shoulder blades to elevate the arms off the ground. So squeeze from between the shoulder blades. Now I'm gonna have you hold for 10 seconds. Then you're gonna lower back down and repeat. You can see the natural tendency is they bring the arms up and back, and you gotta bring them forward. You're gonna be correcting that a lot. And then you lower down and then repeat. Okay? Now go again, bring my fingers closer together. So she's pinching the shoulder blades together and then holding it, and you can see this arm is deviated back again, and I gotta bring it forward, okay? Now what I'll do too is I'll just stand there like this, and so that they get the idea. I'll be like, don't let your arm touch my leg, okay? Now lower back down, and then repeat, just like so. Perfect, so you can see that there. Now she's keeping it in a perfect T. You could do this one side at a time if you want to. Okay, and you can get a little bit more retraction if you go one side at a time. I've found that it's never really necessary. I've never done this and been like, we didn't get results, let's go one side at a time. I've always found that 2 at the same time is fine and saves us a little bit of time. All right, but you can go just with one arm at a time on this. And you can hold them for 5 or 10 seconds. Typically I do about 12 reps here. Now when I do this, I will often see an improvement immediately on abduction. Like the shoulder blades will be sitting closer to the mid-spine. So I will measure it after the fact. Ansmo.
Just a question about the isometric. Is it better to go for higher rep for less tension, or could you also do, say, like 1 rep for 30 seconds?
To answer that, I would say that, you know, there's been some evidence to suggest that if you hold it a little longer, that oxygen deprivation might be a limiting factor. So just doing it in like 5-10 seconds can be good because we still want to get the plumbing going through the area.
Okay.
But who knows? That's what, you know, some researchers are saying. Okay, but I would say, you know, I like to split it into 10 seconds for that reason, because just because it makes sense to me.
Yeah.
But you could do it for 30 seconds. I find that when I used to earlier on in my career give an isometric a little longer, I find the form starts to get sloppy.
Okay.
But I find if you give it to them in 10-second bursts, that we can get a little bit more. Quality on the form.
Yeah. Okay.
And they can rest between reps as much as they need.
It's also better for developing neuromuscular control as well too at that point, right? If they're doing more reps and actually feeling those muscles and time over time.
Exactly, getting in and out of it. And okay, Lori, I'm going to get you to stand up. Let's retest it. Now sometimes I get people to lay face up on the Swiss ball after. And I just let the gravity stretch them out. And it just brings their head back, their shoulders back, everything. So you'll see a picture of that there. That's like a bonus that I'll throw in. So now if I get you to turn around, and I'm just kind of like, once again, testing here. So I'm on that's your mid-spine there. 1, 2, okay, 3, 4. We're 4. So we've gone from 5 to 4. Okay, so you can feel I'm right between the bones there. All right, so 20% reduction in her scapular abduction, which is pretty good. I find that the most I can do is like 2 fingers at a time, typically. Like I could say, you know, maybe we go through another couple rounds, we do a whole bunch of these and different things. I might get another finger off on that one, but that would be about it typically, just to let you know typical results on that.
You mentioned differences in hand positions start getting different muscles. Would you perhaps like say do 3 reps of one specific one? And then
Yes, I would. I'd mix it up. Yeah, for sure. For sure. Good question. Only a member of the intelligentsia would even think of that question. But I just want to let you know that the hand position is not critical, so sometimes I'll pick one, I'll pick another. Okay, so this test here, what was this 1 to 10 again?
5.
This was a 5 out of 10. So she's reduced scapular abduction from 5 fingers to 4, 20% off. This was a 5 out of 10. Let's just see what that's like now. Resist and go.
10.
Yeah, that definitely feels like a 10. Let me go again here. Resist and go. Yeah, like that's very, very stable now. You can feel the difference there. Big round of applause for Lori on that one.